We are now live on Path Tuesday Table Talk, Patient Advocates Transforming Healthcare. Welcome, everyone, to our weekly table talk on Tuesdays. Thank you for joining us. My name is Hala Dura. I'm the founder and a founder of Path, as well as a patient family engagement consultant. I'm really excited to welcome you to another week of our table talks as part of our Empowering Partnerships series. I am really excited to have our guest today, Kelly Goodson, who's a Performance Improvement Program Director at Vizient, for this really important topic we hope to share with you all today around safely accessing care during the COVID-19 pandemic, the importance of patients and families, and the partnerships with them during this time. Kelly, I know is a, very dedicated patient family engagement partner. I've had the pleasure of knowing her for some time, and I know this is one of her deep passions in healthcare transformation work and quality and safety improvement. So I'm really excited to have her here today to really talk to us about their partnerships at Vizient with patients and families and communities, and really listening to their concerns during the COVID pandemic, and certainly how they can safely access care and learn some of the strategies they've utilized that hopefully other health systems and healthcare leaders can really look to during this time where many patients, families, and communities are very hesitant about seeking out their care. I want to remind everyone who's joining us on YouTube that you can always join our discussion if you are signed into YouTube. So please don't hesitate to send us some questions, and hopefully we can get to some of them during our talk today. I also wanted to remind everyone that Patient Advocates Transforming Healthcare, or as I mentioned, PATH, is a diverse and passionate coalition of independent healthcare thought leaders who seek to transform healthcare through integration and advancement of patient, family, caregiver, and community engagement. Through our coalition's advocacy, experiences, and expertise, we serve as trusted partners in the quest for a more equitable and community-centered healthcare system. So today I want to start just giving a little bit of background in terms of what we're currently seeing during the pandemic and some of the issues that certainly have come about because patients, families, and communities have a hesitation to seek care. We certainly know that primary and preventative care have been greatly impacted. And certainly those those preventative screenings that many individuals seek during pre-COVID-19 pandemic times have greatly decreased, as well as immunizations among children and adults, and certainly other healthcare issues that are not being addressed because of the fear linked to going into clinics, going into healthcare facilities and hospitals. So I'm really excited to have Kelly share with us some of the work that Vizient has done to really assess what patients and families and communities feel during this time and how to begin to address some of those challenges. So with that, I'm going to ask Kelly to kind of give us a brief overview of what they've learned thus far and the process they've used to learn what is really important to patients, families, and communities during this difficult time.
Great. Thank you, Hala. I'm really excited to be here with you today and have this conversation. It's really important to have these conversations and to really bring the patient and family voice into improving healthcare, and especially during these times where, this is affecting everybody. And so, the more we can have these conversations and talk about what's important when seeking care, what's important to patients and families. The more we can learn, the better we can improve our processes to make it feel safe for folks to access care. So let me start real quick by just saying who Vizient is. Not everybody knows who Vizient is. We are a national sort of network or alliance of not-for-profit hospitals, health systems, and academic medical centers from across the United States. We actually have 95% of the academic medical centers are our members. That's what we call our clients. We call them members. And we have over half of the community-based hospitals in the United States. So very large organization, but we're very much behind the scenes, and our mission is to help them improve and be the best that they can be, whether it be clinically, financially, operationally. We're here for them. We have a lot of different services available to them as members. So that's who Vizient is. And we started working with, directly with patients and families probably about 5 or 6 years ago now through the CMS, the Center for Medicare and Medicaid Services. They had some quality improvement programs that I know you were part of, and probably many of the folks listening were part of, that really brought to the forefront the need to hear the patient and family voice in our work. I really give a lot of kudos to CMS for bringing that into those programs, and Vizient really took hold of that and worked with our members. And we helped over 40 of our members create patient and family councils if they didn't have one. We really brought the voice of patients and families into our improvement work. If we're educating folks on how to prevent catheter-associated urinary tract infections, we'd bring on a patient, talk about their experience with that, for example. So we started in that vein, and then just kind of sky's the limit from there. And we bring patients and families to our national conferences to speak with their partner health systems. We encourage our partner health systems to do that, to give the full story of their work and how it's affecting patients and how they worked with patients. So that partnership has really become important. And when COVID hit, we were scrambling to help our member hospitals and health systems deal with COVID. Sharing the clinical information. We have a huge pharmacy team. We have 80 pharmacists on staff, probably more than that now. And so we're trying to keep the supply chain going with the PPE and things like that. So Vizient was really involved in the COVID work early on. And when COVID started to have our first little dip there, all of our members were talking about, okay, now how do we get back to elective procedures? And there were many professional medical associations and Vizient giving recommendations to them as to how they restart their elective procedures and surgeries. And I work with some pretty great doctors at Vizient that would be talking to these health systems, and they'd say, well, what do your patients think? And there'd be silence and crickets. And it was clear to us that they hadn't asked. So we thought, well, we need to do that. So on May 1st of 2020, we conducted a focus group with, I think there was a total of over 40 patient and family advisors. We reached out to our member hospitals that we know have PFACs and asked them to invite some of their patient and family advisors to this focus group. And we asked questions about, how do you feel about accessing care? How safe do you feel? What do you want to see in order to make you feel safe? So we had a really great, robust conversation. We asked polling questions, and really coming out of that, we found that the patient's own sort of perception of their risk of getting COVID really drove their healthcare decision making. So if they felt that the risk of getting COVID was really high, and they did not want to access care, they weren't going to access care. It didn't matter what you did for them. They wanted to wait for the vaccine, wait for a proven cure. They were not going to access healthcare. But then there was this big group that said, okay, well, I'm afraid to access care, and I want to talk to my doctor about it. I want to weigh the risks and benefits because I don't want to get COVID, and I need to talk to my doctor whether this procedure is safe and what they're doing to keep me safe from getting COVID. So there was a huge group of patients that sat in those kind of two buckets, if you will. Then there were other groups that they really needed the care. They felt that the care that they needed outweighed the risk of getting COVID. So that was a small group, but it was a mighty group. they really felt like they had to go get that care now, whether it was because of pain that they were in or the diagnosis that they had, and the prognosis that they had. That was, again, that small group, but mighty group. And then there was a group that felt fairly safe. Like I'm young and healthy, or I'm even a little older and healthy. The procedure I need is really quick. I'll be in and out. I won't be exposed that much. So, we kind of had those buckets of patients. But interestingly, the buckets were based on the perception of risk of getting COVID, not age, not gender, not urban, rural, suburban locations. It was just their perceived risk of catching COVID. So that was our original learning from the May focus group that we had. And we shared those results. We wrote up a report, shared those results, shared it publicly as well. And we're so excited by the insights that we were able to carry forward from patients and families that we decided we were going to do a series of activities. We didn't want to stop just there. So in July, we did a survey. So we included the polling questions we asked of the focus group and added a few more. And so in July, our participation went up to, I think it was in the 60, 70 patient family advisors participated. So then we did a follow-up in September, again, asked the same questions, added a few more questions, and that participation went up, doubled to over 120. And then just in December and early January, we did one sort of final survey, if you will, of patient family advisors, and then we did 4 focus groups. We wanted to do those focus groups again and really dig into some of this. And we really had an incredible response. We had over 600 surveys completed, and we had, I think there was a total of 24 patient family advisors that participated part of the 4 focus groups. So I'm going to take a breath right there before before we go on and see if you have any questions or comments on that work.
Yeah, that's great. And I mean, having such a large response, that's wonderful. I appreciate you sharing the process, because I think it's important that, healthcare leaders and systems and even, patient family advisors who may be at health systems, really encourage the health system to really begin to have these conversations. And I think you sharing the process that, you went through to get to that point, to learn that information, I think is really great. Could you share with us just a little bit about maybe some of those particular questions you used in those focus groups and surveys?
Sure. Our main focus at the beginning was just, how safe do you feel overall? How safe do you feel if you had to get a procedure now? How safe would you feel if you had to get a procedure in 3 months? And then we asked about preferred settings and where do you feel safe getting care? And so it was really around sort of that the feeling of safety, and then the preference of the different settings, and what could hospitals and health systems do to make you feel more comfortable. So what we heard loud and clear at the beginning was, why now? What's changed? Like, really, patients wanted to know, okay, it's safe to access care now. Why? And remember, that was back in May. So they wanted to hear all of those things, even those that said, I feel safe getting a procedure now, but let me know what you're doing to keep me safe. So even though they were outwardly saying, yes, I feel safe, they really wanted to know the details. They wanted to know where the COVID patients were being taken care of. Where am I going to go? What exactly do I need to do? What are you doing to keep me safe? What do I need to do to keep everybody safe? So no detail was too small for the patient and family advisors when it came to really, finding out the details. And they wanted data too. How many patients have COVID? How many staff have COVID? They wanted to know all of that information. So we were able to give that information to our health systems to say, if you really want to make patients feel comfortable, really advertise out there what you are doing to keep them safe. So that was sort of an early learning. And as we went through the July and September surveys, we started asking more about preferences and settings. And, you know, just a general sort of insight that we had is that patients want to go to their doctor's office. You know, if they have to go in person to seek care, they want to go to their doctor's office. They do not view the emergency department, retail health settings, or urgent care as safe locations to get care. I think they go if they have to, but they don't see those as safe. Where they see their doctor's office as a safe place to go, whether it's for, you know, in-person care, testing, or vaccines, they want to go to their doctor's office. And you know, when it comes to telehealth, everyone said yes, telehealth is great. Telehealth is safe. It's a preferred way we want to get care. We want it to continue. You know, big spikes on the graph saying yes to telehealth. And so that was, you know, we started that question in July, and in September I said we got to dig into this a little bit. I think there's more to the story. So we asked about what type of telehealth visit would they prefer, and we used video visit with a new doctor, or like a just, you know, just a service, one of those services. I don't want to say names here, but you know what I'm talking about. Or do you want a video visit with your doctor? Do you want, you know, text, email, phone call with a new doctor, or that same service with your current doctor? And off the charts, I want it with my doctor. I mean, it was just, when you add it up, we asked somewhat likely, very likely, somewhat likely, or not at all likely. When you added up the somewhat likely and the very likely, it was over 90% when you were talking about your doctor. When you're talking about just in sort of any doctor, generic doctor, it was more like 60%. Still high, but not nearly what it is for your current doctor. And so, you know, the real insight that we were able to give our Vizient members from that was, you know, if you can figure out how to integrate telehealth visits into the current care pathways that we have. You know, why do I have to come in if you just want to like literally see me and talk to me and ask me questions? Why do I have to come in? Right. So we really feel like we need to take a look at all the services that we provide in healthcare and decide which of those can be done through telehealth safely, so that it's a win-win for the patient and the providers.
That's great. And I remember that particular question, and I was like, I bet you most people are going to respond, I want to see my physician that I know, that I have a relationship with. And I think that goes back to, you know, one of the pillars, right, of patient family engagement and patient family centered care, that importance of that relationship and building that trust, that compassion, that rapport with your physician and your physician's office. And so certainly that doesn't surprise me that so many people responded that way. But I think that gives us a lot of insight, right? And I know right before we jumped onto the YouTube channel to have our discussion, we were actually talking about the role that the physician can play in really supporting and encouraging their patients and families and the communities they serve to really access care and feel confident that it's safe for them too. So could you talk to me a little bit about that? Because I know that was a really important insight that also came out of your work.
Yes. So, you know, not only, you know, that's where they feel safe and that's their preferred setting to get care. You kind of mix that in with that, you know, personal perception of risk of getting COVID, which is the biggest concern for patients and families right now accessing care. And when it comes to things like preventative screenings, colonoscopies, mammograms, those types of preventative screenings, patients want to hear from their doctor about that, whether it's safe to go ahead and do that or can they wait. You know, you and I talked about the fact that there are, and again, those buckets of patients, if you think about the patients that are in pain or are really concerned about their diagnosis, they're going to move forward a bit faster than others, even with things like preventative screenings, or those that consider their risk low for whatever reason. they're going to go ahead. But there's a group of folks that are just going to wait. And the only thing that will really help them move forward on something like a colonoscopy is hearing from their doctor. So, if the healthcare system and especially the physicians can find those patients that really should be getting this screening because of their risk factors, their personal health risk factors, and reach out to them directly, they can draw those patients in to seek that care now. One of the concerns that I have and that we talked about was that, once this is sort of over, there's going to be long lines to access healthcare. So, if you really need that sort of screening, and we can make it safe for you to get that screening, then, the doctor really needs to be the one to talk to you and assure you that it's safe and that you really do need that. And I've actually got a personal story about that. My husband already had his first colonoscopy, and, it came back fine. But he's definitely one that needs to have it on a regular basis. So he had one scheduled for March of 2020. And the appointment scheduler called to remind him, and he said, "Oh, no, I'm not coming in." And she actually kind of scoffed at him and said, "You're canceling because of COVID?" And he said, "Yes, I am canceling because of COVID." And so they rescheduled him for May. So here comes May, that same gal calls him, and he said, "No, I still don't feel comfortable. Let's push it back again." So pushes it back to August. August comes around, still not comfortable. And so this time a different kind of manager calls him and, sort of berates him a little bit and says, "You need this. You have got to come in and get this. You need this." And he said, "Yeah, no thanks." And I said, "How do you feel?" My poor husband, I use him as a guinea pig a lot when he has to access healthcare. He's not in healthcare. And I said, "How do you feel about it? What are you thinking?" And he said, "He just wants my money. He just needs me as a money making thing." And he really felt like the doctor didn't care about him. And I said, "Well, what if the doctor called you? What if the next call you get from the office is from the doctor? What do you think?" And he said, "I'd like that." And he said, "And that might convince me to move forward if I hear directly from my doctor." So, that's some of these ideas of some of the questions that we ask come from those types of experiences that you have as a patient yourself. But, as we know, if you're in healthcare, you just don't see the world the same way as a true, patient or family member sees them, who doesn't often interact with healthcare. So I think that's a important distinction to make.
And that was a great example of really showing why I think the information and data that you collected was so important, that people really wanted to hear from their physician. Not everyone, because I think sometimes that message gets lost, right? People are like, "Oh, well, we can't call 1,000 some patients," but certainly for those patients that we know need perhaps some of those screenings and are at higher risk and perhaps need that gentle nudge and affirmation that it's okay to come back and have that screening. Certainly that would be something that perhaps practices and health systems may want to look to, because as you shared, having someone call you and berate you is also not going to help the situation or encourage someone to return. I guess in these last few minutes, Kelly, perhaps share what maybe you learned that surprised you, and how do you think that those who may be listening, who are healthcare system leaders or healthcare leaders and organizations, can really begin to ensure that these conversations are happening and really understand the importance of the partnerships with patients and families.
Yeah, and the first thing that popped into my head is something that doesn't surprise me, but it surprised my colleagues. So when we started this conversation in at Vizient back in April, before we had the May 1st phone call, I had those great doctors that brought up the fact that nobody had heard from patients, because I've been hammering at them for years about listening to patients, and they really believe in it. So they brought it up, and we brought some new colleagues in that I hadn't worked with before, and they said, "Well, how do we get to patients?" Like, and I said, "Well, we're a healthcare, company. We can we can get to some patients." And they were shocked. And I'll tell you a little behind the scenes. We set up that call for May 1st. I got over 40 patient family advisors to participate within a 1 week notice. And I told them that I felt confident that we could get, a quorum of patients together in that short of a period of time. And the patient family advisors just blew their socks off that they were so willing to give feedback, without much information, much lead time, without much information, they just want to help, and they want their voices to be heard. And I think that surprises people, when it shouldn't really, right? People are so willing to help. I mean, I would get feedback after each event that we did. I would share the reports that we did with the patients who participated and who asked for the feedback, but also who just generally participated. Give them the information. I'd always get some emails back of "Thank you for doing this. This is so important." And just after the focus groups we did in December and January, met a whole new group of patient family advisors I hadn't met before, and they were all just as gracious as everyone I've interacted with in the past. And I think it's just this perception of, well, patients are kind of scary, like they might actually say what they think. And it's true, they say what they think, but there's nothing to be afraid of. I think that's the thing. And all you have to do is ask. It's not hard. You just have to ask.
I love that. Yeah, I mean, you just have to ask probably needs to be just the quote that we put on t-shirts or bumper stickers as to why, patient family engagement is really at our fingertips, but you just have to ask. And I know, you and I could talk for ages, Kelly, but sadly, we're almost at the end of our time. Is there anything else you wanted to add before we have to sadly conclude our conversation today?
I'll just put a plug in for our next report that's coming out. So again, we had over 600 patients complete the survey, and we had about 24 patient family advisors in these focus groups. So we just added to our learning, and because we asked about testing and vaccines this time, which was a new topic. There's just some really great insights in there. So as a patient and family advisor, if you're listening, please share the report with your health system. And if your health system listening, share it with your PFAC. There's really great information in there, and it'll be coming out in mid-February and they can reach out to you, Hala, or to me. Be happy to share. It will be publicly available on Vizient's website in about mid to late February.
Oh, that's great. And I'm very curious to see the insights you got about the vaccine and the testing. That's going to be really important. Well, thank you so much, Kelly, for your leadership, for your commitment to patient family engagement, for really showing that it's just as easy as you said, just ask, right?
Yeah.
And certainly you will hear lots of great input to help us move forward as we continue to battle this pandemic, but certainly we want to make sure that everyone is really staying on top of their health, because as you said, once we get past this point, it's going to be a whole other set of challenges in front of us to access care. So thank you. And I'll be happy to share the report on my page, as well as if you could send me also a link to the previous report, I can also post that with our talk today so that our audience can see it.
Will
Well,
do.
thank
Thanks
you.
for having me.
Oh, thank you, Kelly, so much for your time. So thanks to our audience for joining us for another Path Tuesday Table Talk. We will not be having a table talk next week, February 2nd, but please come back and join us on February 9th, where we will resume our Empowering Partnership series. And thanks again to Kelly Goodson and to Vizient for your partnership and work. And Kelly, if we could just freeze for a moment until we close our YouTube stream, and then we'll see you all on February 9th. Thanks so much for joining us.